In Hawaii and across the country, Trump care would hurt the sickest, oldest, and poorest in our communities. Its drastic cuts to Medicaid would have a devastating impact on our kapuna, who depend on the program for long-term nursing care. In February, I visited with residents of HALE MAKUA on Maui. 80% of HALE MAKUA's residents depend on Medicaid.
Where would these people go? There is no place for them to go.
I don't know. I really wouldn't know what would happen. I wouldn't even want to imagine what would happen. It would be a rough thing. That shouldn't even happen. I hope not.
But that would be devastating. You know, we had a difficult time taking care of him when he was at home, and he's gotten the care that he needs here. The staff has been so super. Nurse Larry, Tito, those people, they've done a lot to help him. It would be a big loss. I don't know what we'd do. I don't know where we would be able to get him or put him.
Hawaii's community health centers treat thousands of our friends and neighbors every year. Under the Affordable Care Act, they've been able to help more Hawaii families access life-saving care, particularly under the Medicaid expansion. But under Trump care, that would all change.
A lot of times the patients, because they don't have insurance, will just go to the emergency room.
We've cranked a few numbers, and we've really looked at the devastating effect of having Medicaid go away. What I have already decided to do if we lose both of those sources is to close down all the small clinics, and shut down admin, shut down the shelter, and only run 2 clinics. I would lay off between 80 and 100 people to start with.
So what would happen to the ordinary people? Let's say you and I, let's say we had an accident. All of a sudden there are no beds in the hospital because they're taken up with people that need nursing home level of care and shouldn't be in a hospital. If you don't have a healthcare system, what does that do to a community? You'll stop seeing the tourism industry thrive here. You'll stop seeing real estate thrive here. You probably see, you know, sort of a recession and an economic collapse here also.
There's talk of pre-existing conditions being a problem again. And I have a couple of pre-existing conditions that cause my health insurance rates to skyrocket. If pre-existing conditions become a factor again, I don't think that I would be able to afford health care.
It's for people like Marie, Keith, Michael, and Alvin that I continue to fight against Trump care. Health care is a right, not a privilege, just for those who can afford it. Hawaii residents have a simple message: oppose this mean, ugly bill.
From high school, I worked in CarQuest, and then from there, I got paralyzed in a car accident. I'm not a politician, or I don't know about these healthcare things, but I know that these programs really help those that are in need. I would really hope that they would take a longer look at it and realize that it does help those that are in need, like the elderly and the disabled.
I mean, access is not just there's, you know, different healthcare plans that you can choose and pay for. I mean, if people can't afford them, then that's not access.
There's no way, you know, to be able to support them and to be able to provide the care that they need. And they'll die. I mean, they will end up dying.